As a surgeon, I do worry that sometimes we treat surgery as a little too routine because we're so used to doing it. As a patient, it's a very different experience, and I am aware of that. It might be your first operation, or you may have had many operations, but every time you go to surgery, it is always a bit of a daunting experience. There are some small measures you can do to prepare for this. If you live on your own, then obviously stock up on a bit of snacks and food, maybe a few ready meals that you can get going with. Even if you plan to work from home, then be aware that, for example, the first few days you won't feel like working. You may not be as alert as you are, and you may be on some medication, so you don't want to be making any big decisions at that point. If you're going to have an operation where we've discussed your mobility might be quite restricted, plan ahead. And if you think it's better, for example, for you to get ready upstairs and then come down and spend the rest of the day downstairs, then set yourself up that way. Be prepared to elevate the leg. Elevation doesn't mean bed rest. You want to be elevating on the sofa, in the kitchen table, or even in your study. But when you elevate the leg, just putting either a seat cushion under the foot or even like a small carry-on suitcase are quite easy ways of elevating the foot without it always falling off a small cushion. I sometimes say to my patients, the way to think of elevation is that you want to bend your knee slightly and you want your shin bone, in essence, to be parallel to the floor. Then you've achieved a good position for elevation that's the most comfortable. In terms of showering, that's important because you can. It's just you need to protect the dressings. So a shower protector, which you can get online, either from Amazon or Limbo, this allows you to get into the shower without getting the dressings wet. Now, the benefit of that is that it means you can shower early. Now, you do sometimes need additional aids in the shower. If you're quite immobile, maybe have a look at something like a shower stool to put in the shower so that you can shower more safely. It's going to feel strange for most patients after having an operation because actually what my patients say to me, it's the first time they've really wound down. We all know we get annual leave, vacation days, but we always stack them up with things to do. But after an operation, there isn't that much you can do. So don't keep the days too busy, but find yourself things you enjoy, maybe the box that you've always wanted to watch on Netflix, or maybe your photo album you wanted to tidy up, and give yourself some activities to keep the days filled. If you have any worries about your recovery, when you have any further queries, you can always contact me.